The opposition that we're seeing from political groups, from conservative groups, we're also seeing some opposition now from groups of doctors and medical professionals.
That's right. We've seen, hospital groups, we've seen doctor groups come out, just today and say that they cannot support the bill. They have deep concerns. This is the American Medical Association. This is the American Hospital Association. These are big groups with large membership, and that's just adding to the fact that conservatives have also, had some concerns and have said that this isn't a bill that they think they could support, even though, it's their own party that's put it out.
Let me ask you about the AMA in particular, the American Medical Association. This is a huge group, a group that backed Tom Price to be the Secretary of Health and Human Services, if I'm not mistaken. What do their concerns center on?
Well, essentially, they're trying to make sure that people are going to still maintain the coverage that they were afforded under under Obamacare, and so there's some concern among the groups that with the cuts to Medicaid that this could cause, and also sort of just differences in how insurance companies have to operate. That there's a possibility people won't have coverage that they had before, that they were able to enjoy, to make it to the doctor. Essentially.
Now that it's been a couple of days, we're learning more about what's in the bill and how it could affect Americans, especially poorer Americans. What do we know now about what they would have to shoulder here under this new piece of legislation?
Well, there are two things. Medicaid is a shared state-federal program for the low income, and there are some cuts coming to that. It starts to wind down an expansion in 2020, and so there are many poor people that might be kicked off of Medicaid. And then there are some tax credits that Republicans are trying to give in place of subsidies that are given in Obamacare. They're lower than those subsidies, and so it looks like, the older and the less money you make, actually, the harder time you might have finding health care that you can afford under this plan.
Last question here about that CBO score. Kevin referred to it just a moment ago. We're waiting to get that. Any indication by when we will get the score from the CBO? And what are other groups, outside groups, saying about who might lose coverage, how many people might lose coverage under this bill?
So this is the CBO score. We heard from Nancy Pelosi's office, who is the minority leader. She's a Democrat, but she said that the CBO score won't come until Monday. So this could be long after these markups are over that are going on today, even though they will last a long time. And then, that will give us the true look at how many people might lose coverage under this or how many people might gain it. But there have been some estimates out there. I believe S&P put one out yesterday that talks about 4 to 6 million on Medicaid and 2 to 4 million in the individual market. And so that's still millions of people.